Welcome back. The deputy political leader of the SLP, Dr. Ernest Tilley, is cautioning the Prime Minister not to make any new commitments at this time. With only 1 month left before Parliament is dissolved, Dr. Tilley says that it is not a time for more borrowing or commitments. He gave the example of the lease agreement made with Orange Grove Plaza Limited and the government of St. Lucia regarding the Dyer building.
Immediately after the 2006 general elections, which the UWP won, the government of St. Lucia bought the abandoned Dyer Mall for just over $45 million. It was argued by Alan Chasney, who was then the Minister of Tourism, that this was a wise investment and government would complete the buildings for office space. The total space of the building is about 280,000 square feet. In 2001, it was valued that when completed, land and buildings would be valued at about $90 million. The building remained abandoned ever since 2001, ever since 2006, that is for 15 years, with government having to repay a loan on its purchase. It means that government would have paid over $45 million on this investment by 2020.
Dr. Hilaire says the sale was a bad deal.
In August 2020, the land and buildings were sold by Amazona Properties. Amazona Properties was a government holding company. It was sold to Orange Plaza Limited for $13.5 million. It means that government lost over $30 million plus 11 years of interest on that sale alone. We lost over $30 million on that sale alone. The government has now agreed, after selling the land and buildings for $13.5 million, therefore losing $30 million, as I said, to rent portions of the second and third floor, totaling 78,000 square feet. That means that about a quarter of the space of the building, because the total building space is 280,000, we'll be renting 78,400 square feet, and we'll be renting it at a rental rate of $313,624 a month for 15 years. This is about $3.7 million a year.
That was the deputy political leader of the SLP, Dr. Ernest Tilley. Another life-saving treatment for COVID-19 has been found in the trial, which included nearly 10,000 UK hospital patients. The treatment significantly reduced the risk of death and the length of hospital stay. Results from the recovery trial suggest it could help 1 in 3 of those in hospital with severe COVID. For every 100 patients treated, experts calculate it would save 6 lives.
Researchers say they have found another life-saving therapy to prevent deaths from COVID-19, exactly a year after the discovery that a cheap steroid drug did something similar. Treatment involves using antibodies to neutralise the virus. That means it's only effective in people whose bodies have not previously developed antibodies to the disease. A single course costs up to $3,000. Clinical trials suggest it could help 1 in 3 people in hospital with severe COVID symptoms. And for every 100 patients treated, experts calculate it would save 6 lives. Let's speak now to Professor Sir Martin Landray, an epidemiologist from the Big Data Institute of Oxford University. He is at the joint chief investigator for the recovery trial for COVID-19. Sorry, that was quite a mouthful. This sounds quite a significant development. How did it come about? Was it through random science or targeted science?
The science itself is targeted. Of course, a year ago, this was a new virus and we had no new treatments. But during the course of last year, many companies were developing antibodies targeted at the virus itself. And then from last September through to the middle of May, we ran, and actually to use a word you've just used, a randomised trial in which patients in the NHS either got the treatment, the active treatment, the monoclonal antibody, or they got the best usual care that the NHS could offer, but without the additional antibody. Now, that's been enormously successful study because 10,000 people were enrolled. These are patients who are really quite sick, they're in hospital. And as you've just highlighted, what we found was that for patients who had failed for whatever reason to develop antibodies of their own, if you give them some in the form of this drug, then actually we save lives, shorten the time in hospital, reduce the need for ventilators. Good for the patient, but good for the health system, both here in the UK and elsewhere.
The previous discovery, I think, was dexamethasone. Does this need to be used in conjunction with that?
Yes. Most patients who are in hospital have low levels of oxygen, so they require oxygen or possibly even ventilators. And this treatment works on top of that. So by comparison with where we were at the beginning of the epidemic, dexamethasone saved some lives. Adding this on for people who haven't got antibodies saves more lives. Actually, there was another drug in between, a drug called tocilizumab, which is another immune suppressant drug, which also saves lives. So we've now got 3 treatments that for the sickest patients will improve their chances of survival. That's a big step forward and wouldn't have happened without this enormous clinical trial here in the UK, run by frontline doctors and nurses in the most difficult times over the last 6 months.
Of course, and just briefly, was this the treatment that doctors used on President Trump, which was semi-experimental at the time?
Yeah, it's exactly that treatment. And you're right, it was experimental at the time. It's still not licensed, but I wouldn't say it's an experiment anymore. We now know it works.
All right, OK. Professor Sir Martin Landray, thank you very much indeed for joining us here on BBC.
St. Lucians are again being urged to quit tobacco use as it presents a severe threat to their health. More in this report from Jacques Hinkson-Compton.
St. Lucia recently joined the rest of the world in observing World No Tobacco Day. The event, which was organized by the World Health Organization, seeks to discourage persons from tobacco use. This year's observances are being held under the theme Commit to Quit. In a panel discussion held to mark the occasion, Senior Medical Officer for Non-Communicable Diseases, Dr. Shana Sear-Filbert, reminded the public of some of the dangers of tobacco use.
Smoking affects every organ in the body, especially your respiratory system. So of course you're inhaling smoke. Your body was not made to inhale smoke. And so the whole immune system of your respiratory system is affected. So smokers tend to be more prone to getting respiratory diseases like tuberculosis, they get flus, etc. Diseases like that more often than someone who does not smoke.
In 2019 and 2020, St. Lucia enacted new legislation designed to reduce the number of public locations in which people can smoke. Deputy Director of the Substance Abuse Advisory Council Secretariat, Joanna Joseph Henry, explained the intended benefits of the laws.
The big concern right now is to try as much as possible to reduce the exposure, the initiation of our young persons into tobacco use. The Public Health Act was revised to allow the control of smoking in public places, in workplaces, enclosed places, enclosed public places, as well as outdoor public places. So the purpose of all of that is to reduce the exposure of individuals to tobacco smoke.
The 2021 World No Tobacco Day observances also included the unveiling of a new mascot named Luther Lung, which was designed by a student of the St. Mary's College. For the Ministry of Health and Wellness, I am Jacques Hinkson-Compton.
St. Lucia Distillers is being commended for its continued confidence in St. Lucia's economic development through the expansion of its facilities in the Roseau Valley. Over the past 18 months, the premier rum producer in the Eastern Caribbean built 3 new cellars with a capacity of storing 12,000 oak barrels. More in this report.
Prime Minister Alan Shastney headed the list of dignitaries, which included Bernard Ayotte, the president of GBH, the parent company of St. Lucia Distillers. The occasion was the official opening of 3 new cellars built over the past 2 years with strict adherence to COVID-19 protocols. Prime Minister Shastney noted the commitment of GBH in spite of the global pandemic.
And I want to thank you personally that despite what was going on with COVID, I am one person who does not take your commitment and your continuation for granted. I want to thank you very, very much.
Bernard Ayat, the president of GBH, was present for the official commissioning of the new cellars, but it was his son, Rudolf Ayat, who provided the details of the project.
Each of the cellars will contain nearly 3,700 oak barrels. They will bring the total capacity of St. Lucia distillers to more than 12,000 barrels.
The construction of the new cellars is one of 3 projects earmarked by GBH since it acquired the distillery in 2016. The first ensured that award-winning rums produced by St. Lucia distillers got profiled and marketed globally. Another project is the development of a rum and heritage attraction in the Roseau Valley. This was welcomed by the Member of Parliament for that area, Dominic Fede, who is also the Minister of Tourism.
While we can boast of some of the finest beaches in the world, I think what makes us really sexy is to say to the world that we also have some of the finest blends. And that in itself is a big draw and makes us extremely attractive. And so congratulations to you and the entire rum industry for your continued evolution over the years.
The Prime Minister also applauded the employer-employee relationship, noting the role of the National Workers' Union.
I'm very happy to see the relationship that you've developed with the workers. This is a very important aspect to what we do in our country. It cannot be that we believe that we can succeed without bringing along the workers of this country. And so one, the investment you're making, the training you're making, and certainly the upgrading of the equipment, I know will augur very well for the persons who work here.
The next major development at St. Lucia Distillers will be the Rum and Heritage Tour, which will be situated on a 25-acre site. It will incorporate the distillery and a sugar plantation.
Stay with us, we'll be right back.